Hi, everyone. I'm Sam Osterhout, the executive producer here at Lincoln Square. And I have this thing has been bugging the shit out of me. And I'm sorry to swear so close to the top of the show. But last week, Trump signed an executive order in the Oval Office with RFK Jr. standing beside him. The executive order was called the gold standard for childhood vaccines. And I have kids in school, and I know a lot of you have or had children who went to school and were kept safe by vaccines. And so I wanted to talk about this, and I have a guest coming on who is uniquely positioned to sort of go through this, but I want to just set this up a little bit because the EO cuts the list of diseases that we vaccinate against American children against from 18 down to 11. It orders the MMR vaccine, which is the measles, mumps, and rubella vaccine, broken into 3 separate shots. And it says that to the maximum extent feasible, children should get every one of their immunizations at a separate visit to the doctor, right? And that, it sounds like, oh, let's space this thing out, but there's something really insidious about that. There's a lot to talk about with that. So there's a problem with it. And look, the measles only vaccine, well, it doesn't exist. And neither does the mumps only vaccine or the rubella only vaccine. None of them exist currently. Merck stopped making them back in 2008. So they did exist, but they don't exist any longer. Merck says that building them again would take more than 10 years. The World Health Organization has never approved a standalone mumps vaccine anywhere on Earth, right? So the president has ordered doctors to use a product that will not exist until sometime in the late 2030s. And splitting it would not reduce anything. It's the same 6 doses. It's just 6 needles instead of 2. And if you have a kid who hates needles, just imagining telling my kid, you get a shot, and then we're going to go get 6 more of them it's like trauma, right? So when a reporter asked the president what this was based on, he said, quote, "This is based on what I feel." And then he said, "I am making these statements from me. I am not making them from them, these doctors." So here's why it matters. The United States has recorded 2,465 measles cases this year. It's the worst year since 1991, and we still have 4 months left of 2026. 93% of those patients were unvaccinated. And this November, the Pan American Health Organization decides whether America still qualifies as a country that has eliminated measles, a status we've held since the year 2000. So we have this EO, this executive order that can't be enforced, ordering a vaccine that can't be made to solve a problem that literally does not exist, arriving in the middle of the worst measles outbreak in 35 years. The order changes no law. What it changes is what a frightened parent believes when they sit down across from their pediatrician, which is where our guest comes in. Dr. Rob Davidson is an emergency room physician in rural West Michigan. He's the executive director of the Committee to Protect Healthcare, a network of thousands of doctors across 14 states. And he's the co-host of Paging America. Dr. Rob, welcome.
Thanks, Sam. Good to be here. Hard to sit through that recounting of everything that happened with Trump. You know, you're kind of reliving it, a little PTSD, but good to be here and talk about it with you.
Yeah, well, look, I want to start with measles because, you know, we had eliminations. We still currently, for the next couple of months at least, have elimination status, which means that most of us have never experienced measles or understand what it looks like. What does measles look like?
Right. I mean, so the concern with measles is if you end up with a severe case, and severe cases of measles can end up in measles pneumonia. That is a disease that would often hospitalize, particularly kids. or people who are immunocompromised, and then measles impacting the brain, measles encephalitis, or that causes inflammation of the brain, right? That can cause, hearing loss and vision problems, cause seizures. And in rare cases, thankfully rare, but still not zero cases, it can cause death. And so we have this sort of miracle that can actually literally prevent it. And if you have a high enough percent people in the population, currently the data tells us around 95%. That's kind of the cutoff to keep the entire population safe. You can basically prevent it, right? Prevent it even if it crept into a community from one individual, maybe from outside, what have you. Keep it from actually taking hold and spreading, creating an outbreak. And that status is very much in question, and the number of cases is just unbelievable. It's given what we have to combat it.
Well, yeah, it's not difficult, right? We've solved the problem. So I wonder about we'll get into this a little bit later, because what always strikes me about this administration, not just with vax, but with almost everything, is they're solving problems that just don't exist.
Yeah.
And creating more catastrophic problems, right?
Yeah.
And I understand that you mentioned 95% vax rate delivers sort of herd immunity and that kind of thing. Yep. And many states are now hovering at 93%. We're dipping down. Trump said, he said, I took my children for 5 different vaccinations. In other words, I broke it up.
Yeah.
They get 20% each, and I had no problem.
Wow.
Okay, Dr. Rob, is that how vaxes work? You just give 20% of the vax over 5? Can you talk us through this?
No, I mean, the schedules are based on what we know that these vaccines, how they induce an immune response, right? What we're doing is we're giving you a little bit of the protein. In some cases it's a virus that's been modified or attenuated so it doesn't cause disease. Other times it's just pieces of protein. With the new technology, right, with the mRNA technology, it's giving you this bit of sort of a brief genetic code to have your own body make those proteins, make the antibodies to fight that particular disease without you actually getting sick. And it's actually based on data and research and science to say what is the best way to induce the response that gives you the best protection. And so just willy-nilly kind of chopping it up in pieces the way he described it isn't a real thing that any credible physician would do. And listen, editorial comment, I don't believe for a second Donald Trump was the one taking his kids to the pediatrician's office. Doesn't give off that vibe. I think he skipped his kid's wedding, this past year. So who knows, right? We weren't there.
The only time he took a kid to a doctor's office was to get a paternity test.
Oh God, yeah.
So look, I want to play a couple of videos here, but the first is where Trump chimes in on what could happen. Nothing bad could happen. Let's watch what he had to say to CEO.
There's questions about, we're going to figure it out, and I think we'll, the expression is we have really no choice, and nothing bad can happen from what we're doing. Nothing bad can happen. It's possible it doesn't work. I don't think that's much of a possibility, frankly. We're going to learn a lot, and if we could go back 20 years, 25 years, something happened in between that would lead us to the kind of numbers that we're seeing. So
look, all of this is feelings and vibes and his gut and stuff that he's read on, the internet or heard on Fox News. Right. He said, the MMR combination, quote, could be a possibility. They are quite lethal.
Yeah.
Can you talk us through that just a little bit?
Yeah, right. The diseases could be lethal if you're not protected against them, right? Every shred of evidence we've ever encountered tells us they aren't lethal. Not only that, they are actually protective. They don't cause autism, which is how this whole thing started with RFK Jr. and how his career as an anti-vaxxer started. The only problem in this country, and not just this country, I mean, Canada has, similar problems kind of everywhere, is vaccine hesitancy, which is fueled by disinformation and misinformation, which, Trump is contributing to, which RFK Jr. has had the latter half of his adult career pushing out these the bits of disinformation about vaccines. Like, that is the problem. And something that the Department of Health and Human Services, the CDC, used to do, but they don't now fund to the same extent, is combat the vaccine disinformation and misinformation, trying to encourage parents to get their kids vaccinated because we know how beneficial it is. And so, like you said, they create a solution to a problem that didn't exist. They're actually doing the opposite. A problem really does exist, and their solution is to exacerbate that problem, or at least, to not make it better. And to the extent that someone's going to listen to Donald Trump, I have a theory of the case that doctors aren't. I mean, I noted how many doctors I saw show up on my feeds, but how many organizations of doctors, the American Academy of Pediatrics, family physicians, American Public Health Association, everyone came out and said, yeah, this is crazy, don't do this. And if you go to your doctor, if they are a credible person who's actually worried about your kid's health, they will say, yeah, no, we're not doing that. Here's what we're going to do. Here's what I recommend, because this is what is actually going to protect your kiddo.
Well, so, I want to talk about that a little bit, the experience of the doctor. You are an ER doctor, so you aren't having those conversations. You're seeing the end result, right? Generally.
Yeah.
But the pediatricians, like you said, the AAP has, as far as I know, for the first time ever, veered from the CDC recommendations, guidelines, and they've created their own guidelines, which are basically the old guidelines.
Right.
What are pediatricians? What are the visits like? First of all, the purpose of this EO is not to change law; it's to change minds. Right.
Right.
It's to instill skepticism. The president says, "Look, these vaccines. Who knows? They could be very dangerous. It could be lethal. Probably they're lethal." And so you have that. And look, 95% of us need to be vaccinated, but 94, that's dangerous. 93, it's those margins, right? So what do, with Trump and RFK Jr. in power now, what do those pediatrician visits look like?
Yeah, I mean, I can tell you secondhand from a family physician viewpoint who take care of kids, as part of their routine practice. I'm married to a family doc, and like you have so many minutes in a doctor visit, right? Like that, like our system is so built on productivity, and doctors are faced with like clicking 20,000 buttons for every visit they have, and so much of that time is occupied by just clinical taking care of you type medicine, and these conversations tend to dominate some of those visits now, where people are, well, boy, I don't know, I heard this, I heard that, I read this. I mean, for adults, when it comes to flu and COVID, I can't tell you how many cases and the notable upswing of cases of people who don't want their tetanus shot. Right, you cut your foot on a rusty nail. Getting your dock in the water. I work in a place with a lot of people, with summer places, and saying, I think I want that. And you look, he said, well, you got it 11 years ago. Like, what's up now? He's like, I don't think I need it. And I don't engage in political discussions, but I explained to them, listen, we hardly ever see tetanus. I've never seen tetanus, right? We almost never see it because people get boosted against tetanus when they cut their foot on a rusty nail. They don't get it, and yet it's the reality of those conversations, and it takes away from all the other pieces of what you are trying to do at that visit, promoting health.
People are refusing tetanus shots?
Oh, yeah. Oh, for sure.
That is mind-blowing.
Yeah. There's probably data out there. I haven't researched it, but I can just say anecdotally, in a career of 28 years, that it has noticeably ticked up. And it mostly started kind of around the COVID and the vaccine for COVID, that thing. I mean, I will tell you, the craziest case was a parent whose kid needed a blood transfusion, and they, for a very long time, refused it unless we could ensure the donor did not receive the COVID vaccine. And like, that's not a thing. And eventually that person was convinced from with the children's hospital, like, hey, this is really dangerous. But like, that is the level of distrust that RFK Jr. and now, Trump joining the bandwagon here, that's what they're introducing into the population, and that's the potential damage they're having on defenseless people, these kids, right? They have no say in it. They're just going along. Whoever their parents happen to be, that's who they get. The other thing I'll say, just to really be critically important, I don't believe that parent at that time was trying to hurt their kid. They really believe it was a dangerous thing. I've seen kids unvaccinated come in with a fever and some symptoms, and you might, get a little worried about this disease or that one that you don't think about in other kids. These are parents who love their kids. They're not doing this to hurt their children, but they're being led to believe that these, the gold standard of pediatric healthcare, the full vaccination schedule, like somehow that's going to hurt their kids. And they think they're just really being good parents and refusing them. And it's really sad that the president now is using the Oval Office to help promote that.
Well, look, I think, I think about any kind of treatment with my own kids as a sort of cost benefit, right? Do they need this antibiotic? Can we hold off on this antibiotic because there's so many antibiotics happening, or does the kid have pneumonia and let's get it cleared up? Like, what is the risk and what is the benefit? And it seems, I think, to those of us who aren't vaccine skeptics, that the cost benefit, if your kid needs a transfusion, right? Skipping that, the cost is catastrophic.
Yeah.
Right.
Potentially, sure.
The cost of getting a transfusion from blood that potentially has COVID antibodies in it.
Yeah. Yeah.
So I want you to conjecture, but I'm not going to force you to conjecture to get in these people's minds. But what is really happening in the mind of somebody like RFK Jr.? Because I understand parents are always trying to look out for their kids, and they believe that the cost benefit is reversed of what the actual truth is. What about him?
Yeah.
What's he really?
For some portion of his career, there was a profit motive, right? He led lawsuits against, I think, particularly the makers of Gardasil, right? The vaccine that prevents HPV and prevents cervical cancer. And like my kids all got it, right? Like that's, but that's one of the ones. It's still on the list that they recommend. Like the data was so clear. It's like, wow, we can actually prevent cancer. That's the insanity a little too far, apparently, for the administration. So there, certainly a profit motive. I think for a lot of the influencers, it's like the distinction of the MAHA movement, like the people who care about pesticides and food additives and having a healthy world for their kids and actually want affordable healthcare. Like that's a group of people, like I get on board with all of that, right? But the influencers in MAHA world who are pushing like unproven superfoods, and before we got on, I was talking about seeing things popping up in my feed about honey, homestead honey that is supposedly okay for infants. Like this is editorial note without a doubt. Don't give your under 1-year-old honey because they could get botulism.
Everybody knows that. Everybody.
Yeah, it's crazy. And so
like the first thing they tell you in the hospital when that kid is born, no honey.
It feels like there is always some motive of grift and profit involved in a lot of this. And so for RFK Jr., like having this movement, like being the leader of MAHA, I mean, he coined the phrase MAHA, but being kind of the standard bearer of so many in that movement got him to where he is as the cabinet secretary, right? I think the reporting was pretty clear. He shopped around his potential endorsement to both the Harris and the Trump campaigns. And from the reporting, Harris campaign said, no, we're not interested. And Trump, MAHA and MAGA turned out to be a pretty potent political unity to get him elected. Right now, the breakup is pretty clear as they're pushing pesticides and they're pushing vapes, flavored vapes and flavored nicotine pouches and all these things that are not promoting health, that are actually dangerous. Like that breakup is happening before our eyes. But that certainly a motive of RFK Jr. Guy got to be a cabinet secretary and get the biggest megaphone he could imagine when it comes to spreading this the fear mongering and the disinformation.
I know, or I've read some stats that the MAHA folks, the MAHA contingent, their priorities are healthcare costs.
Yeah.
And healthcare costs.
There you go.
I will never change that setting. Just my word. And also food additives, I think. Or basically, vaccines aren't on that list, and yet they take a huge priority with RFK Jr. You mentioned HPV, also with the white Christian nationalists have a problem with it because it's sexually transmitted and all of that. And if you get the vaccine, that must mean you're some kind of pervert or going against God. I want to play another Trump quote about Hep B, and then get your take on this.
Year one, you should have 5 separate visits.
Oh, different one. We'll get there.
In the same day. Very importantly, vaccinations for hepatitis B, COVID-19, and influenza, among others, are no longer recommended for all children. In addition, this executive order directs the Attorney General to advance legal challenges against states that violate children's rights to religious or medical vaccination exemptions for the
So, look, the Hep B is another one like HPV that is insanely sort of politicized on the right because of Hep B's links to sort of sexually transmitted diseases, and he wants the Hep B vax either eliminated or pushed to age 14 or 15. He's called it a sexually transmitted disease with no business in a newborn. He says. Now the birth dose, I'll remind you, cut infant Hep B by 99% from 16,000 cases to 7.
Yeah.
So what is happening? This feels like, I mean, look, measles, there's 2,500 cases. It's spiking. But Hep B is in a different class.
Yeah. Yeah, those babies are, I mean, come on, we don't have enough to say it, but they're not getting it through sexually transmitted diseases. It's vertical transmission from a mother, right? And during birth. And I mean, this is something even soon to be former Senator Dr. Bill Cassidy has lamented, right? Like the guy who gave the green light, right? Who voted RFK Jr. out of committee, who got him to that cabinet spot. He had this singular ability to deny us this era of RFK Jr. heading up HHS, and he didn't do it. I see him now kind of as, trying to kind of clear up his conscience, I guess, saying, well, had I known he was going to lie to me, it's like, come on, there's something about a scorpion and a frog, right? Like if you were duped by this guy sitting down with you telling you I'm not going to do anything on vaccines, like, shame on you. We all could see the writing on the wall. Right. And he's a gastroenterologist. He saw the outcomes of this chronic liver disease and liver cancer and these preventable cases, and saw in his career the massive decrease, like you said, 99% decrease from a vaccine. I don't understand any rationale for this, except that, if they're equating it like HPV with something sexually transmitted, and somehow that equals, some level of purity that people need to maintain to not get it. It's not based in science or fact, but it may be the way their brain is broken to think about this. It might be what we're seeing.
They need a vaccine for broken brain syndrome.
Man, something for the worm. We need a vaccine for the worm that took over RFK Jr., right?
You got to get deloused.
Man,
maybe
ivermectin is what we need for RFK Jr. It does treat worms, by the way. It doesn't treat COVID, doesn't treat cancer. It treats worms. That's what it's for.
Maybe some bleach?
Yeah, I don't know. Let's not go down there.
Yeah. Oh yeah, okay. Right. Yeah, we're not here to spread misinformation.
Yeah.
So, I'm curious about this because I want to try to tie this in a little bit to the election, the midterms, and all this. And I think, there's some commentary, and I think it's, it's a little premature, but that Kennedy clearly seems to be vying for president. As you mentioned, he's I know, like,
yeah. Wow.
As you mentioned, he went to Harris and to Trump. He's kind of an equal opportunist. And he put together a new vax panel. He reconstituted the vaccine panel. It includes a climate scientist, a businessman, a board member of the National Vaccine Information Center, which is a anti-vax organization, a former member said almost every statement made by this committee was misinformation, disinformation, or outright lies.
Yeah.
So understanding that, we don't know RFK Jr. trajectory at this moment, but we do know he's got a cultural and policy impact. Where do we go from here? And he needs to be stopped.
Yeah.
But the misinformation is going to continue to come, and it's going to continue to have an impact. I'll say that in a recent outbreak in South Carolina, there were 9 of measles, 997 cases, 874 kids quarantined. During that period, the MMR vax went up 93.6%.
Yeah.
People rushed. They rushed out to get it. So where does the rubber hit the road with this stuff? And when does this bullshit stop happening?
Gosh, what do we do about it? I mean, to me and to us as an organization, it's hard to put the toothpaste back in the tube, right? Like to shut off the streams of disinformation, I think is not a realistic goal. I think if that is the goal, we're going to have long careers of being very disappointed in our ability to do that. But it's about volume and volume, right? Volume in that you need to get the message out about the truth, whether it's vaccines or rising healthcare costs in particular. Need to get it out in as many places as possible, right? Me coming on here, us having our show on Paging America,
yes,
going anywhere and everywhere as doctors in particular, as scientists, just as individuals, right? Even in your own Facebook feed, just resharing, reposting. So maybe that friend from high school just happens to see it a couple of times, juxtaposed to the crazy stuff they're seeing from their uncle who, is posting the anti-vax messages. And then the other thing is volume, right? Be louder than them, right?
Yeah.
So the 2 types of volume, right? Put it everywhere, mass amounts of information out there, the real information, and then just as loud as you can. Use the biggest megaphone you can find. And so I think it's building, we're building a decentralized media project at Paging America, where we're talking about these things. In addition, a lot about the politics of healthcare, right? The outcomes of elections and how they impact people's healthcare. States like Wisconsin, where if we can get a trifecta in Wisconsin, we can actually get Medicaid expansion, right? It's the only northern state not to have expanded Medicaid thus far, and that is on the table, right? Like a lot of people can get healthcare in Wisconsin if the Democrats get control of everything, and then we as advocates can push them to do the right thing, which everything tells us that's a possibility, which it hasn't been now for too long. And so, yeah, I think it's just outcompeting them to get attention and get people to see the message.
Yeah, it strikes me when, I had little kids during COVID, and around that time, there was that kind of weird, it wasn't MAHA yet, but it was this kind of, some of our friends were breaking off anti-vax, even hormone treatment, just sort of anti-red dye, which whatever, all of this stuff.
Yeah.
They were sort of being red pilled by Joe Rogan. And what I found at that time, and it links to what you're saying, is that I'd see them on the street and they would jump into it.
Yeah.
They would say, hey, I'm going to the Capitol and I'm going to protest the vaccine mandates. And my wife and I were so shocked. Like I had not trained my brain to have this conversation yet. And you do need to practice having conversations so that you know what to say, you know how to respond. So we didn't respond. And I think back about that, these people, had they said it back then, maybe now, and I know what I know now, I would have been more or less reluctant to have that debate with them.
Yeah.
Maybe I wouldn't have changed minds.
Right.
We're like, social media is a tsunami of misinformation and I'm just one guy, but maybe it presents just a tiny bit of doubt in their minds. I want to ask about Michigan, your state, because it's first of all, everyone's looking at Michigan right now because of El Sayed and the midterm race. And El Sayed is I understand he didn't get his licensing, but he is an MD. Is that right?
He's a doctor times 2. He's an MD and he's got a doctor of philosophy and I believe in public health. But yeah, he's got 2 doctorates for sure.
So at the same time, though, where he's, our Democratic candidate in Michigan has relaxed the opt-out laws for vaccines. What's going on?
Yeah, it is troubling. I mean, my kids are all now out of school, right? My last one's still in college, and so we didn't have to live through that. And it's this. I mean, it's a constant back and forth and a struggle for allowing parents to make medical decisions for their kids, and then kind of having school districts and in this case entire states, try to ensure the safety and protection of all kids. I think we've gone too far the other way, right? It's tough because you're sending a big group of kids to a public school, and if you are now allowing diseases to potentially pop up, the kids who do have an immunocompromised state, right, are put at risk. And so I think it's going to be this back and forth, and I would urge the next administration coming in and the health department of that administration to really, really work to just increase vaccine rates, decrease the misinformation and disinformation. So hopefully at least we can get parents to come to that decision on their own. And or as far as El Sayed, you're right. Like I'm excited. Like as a group of doctors, the Committee to Protect Healthcare, I mean, we got 40,000 docs, 50,000 healthcare professionals. Really, every state now we have them. We've done policy work in I believe now 18 states, but very active in Michigan. And the doctors here in Michigan, like in the organization, are just jazzed up to have a doctor potentially representing us in the Senate. We currently have 4 doctors in the Senate, right? Barrasso, Paul, Cassidy, and Roger Marshall. Well, I mean, Rand Paul, we saw what he did with Fauci. All of them, but Rand Paul voted for $1 trillion in Medicaid cuts. I think for Rand Paul, he said, well, it didn't go far enough, essentially. And Roger Marshall was on just a couple weeks ago talking about the Iran war, said the doctor in him sees the benefits outweighing the risk, like invoking his status as a physician to justify the war in Iran, right? The killing of school kids and the spending of billions of dollars instead of paying for healthcare. Like that's what we have as a profession to look to currently in the U.S. Senate. So having somebody who actually wants healthcare for everybody, right? What does he say? Money out of politics, money in your pocket, healthcare for all. Like, yeah, sign me up, man. I don't get us there somehow, but we'll take it. And having a guy who knows the issues and can like get the work done in DC, that's huge. And we're going to work our butts off to get him there.
And you want to make any predictions?
No predictions. But I think I will predict that we will work our butts off to stand with our fellow doctor and help the folks here in Michigan see the benefit we will have as a state, having someone with his credentials, his background in DC representing our interests and what that can mean for the folks in Michigan and across the country. He's one person, right? 1 out of 100. But I think you need those leaders in those particular fields. And for me, for a career in medicine and now, a career in health advocacy, what a gift to get somebody like that in DC and pushing the issue and just never letting up on it. I think that's going to be huge.
Amen. And I think, look, people like RFK Jr. and Trump found a system that advantaged them dramatically, astronomically. And RFK Jr. says children have a problem being malnourished. And his first step, red dye.
Yeah.
Right. That is not a solution to this problem. If you want children to be healthier, they need access to medicine, to healthcare. And this was a thing that, I wanted to talk to you, especially as somebody who practices in a more rural area, these vaccine requirements, and we don't need to linger on this, but the vaccine requirements, if you separate them, that means 5 or 6 appointments a year.
Yeah.
And who does that impact the most? Rural and poor. Families who cannot afford to take time off and who also simultaneously can't afford to get sick.
Yeah. I mean, in the world, right? Like you look at other countries in the world and they say, well, in this country or that, they have a different schedule, or even during COVID, right? The way they did it. But these countries also have universal health care, right? They also have paid parental leave, right? They also have, they have a system in a society that actually takes care of people, including taking care of the poorest among us. We have a society where Donald Trump enriches themselves by billions of dollars just by being president, right? We have a society where senators and members of Congress trade stocks on insider information and are making millions of dollars. Like, that's what is prioritized in this country. The thing you talked about with meeting up with people on the street you knew and they were going to go and protest, like, that made me think, the truth is, in rural communities and really everywhere, people have been let down by the government, both sides, right? The entirety of government people have felt left like they've been let down. When they say we can't afford health care, Affordable Care Act, right? Like earth-shattering change in a policy, but really a building block of what we need to have is truly universal health care. And it feels like some people, and I think these people have to get on board with the idea of universal health care, kind of said, hey, we did that, good, we're done, what's next? And the reality is, yep, we did that, and it did decrease the rate of increase of cost, but that's hard to put on a bumper sticker and convince anybody that it's actually helping them, right? Even though, like, the alternative reality would have been, and we see with the expiration of the subsidies, 3 million more people without health care, hospitals reporting up to 20% more people coming in without insurance. Like, that all really happens when you take that away. But man, we got to go to the next step. Like, people, and I agree with them, like, people should not accept anything less than, like, truly universal, affordable, lifetime health care, health insurance. Like, that has to be the goal. And like, for me, like, hey, we send out our endorsement questionnaire to every person running for federal office, and in some states as well. We'll endorse a Republican who takes that on, right? And that is I just haven't found him yet. So in this case, if it's the Democrats and they take over, starting in 2027 in the House and Senate, you got to be bringing those CEOs of insurance companies and pharma and hospital systems and saying, why are things so expensive? Why does it cost so much? And then when you get control of everything in 29, you got to come out with big swings on healthcare costs, because it's a human rights issue, but it's an economic issue for people. And I think if you let them down again, we're just going to get more and more people distrusting anything that can happen with government, and they're going to believe any other alternative that comes their way.
Yeah, the real Make America Healthy Again is addressing the income disparity, wealth disparity, and universal health care.
Yes.
That's it.
Amen.
Well, Dr. Rob, I appreciate you. Dr. Rob Davidson is an emergency room physician and the executive director of the Committee to Protect Healthcare. And you're also the co-host of Paging America. Where can we find you?
Yeah, boy, Paging America. Check us out on Substack, but would love you to come check us out on YouTube. We putting content out at least 4 or 5 times a week. Got a couple of shows every week, and then we have an on-call series. When something like the executive order on Monday pops up, we'll hop on and give a little commentary. Go on YouTube, give us a like, subscribe, help spread the word. Again, another channel out there trying to combat what's coming out of this administration and adding to that volume that is going to be how we overcome the disinformation.
That's right. It's really an amazing resource. Thank you for joining. Really appreciate it, and would love to get back soon.
Anytime. Thanks, Sam.
This shit's not stopping.
No. Well, the shit from Cyclospora seems to be slowing down, but all the other shit's coming at us full bore.
That's a nice callback.
Yeah.
All right. See you next time.